I'm Melissa.
And I'm Lee, and we are busy mums, company founders, and all-round early learning nerds. Welcome to our podcast, Growing Little Humans.
Kids aren't born with a user manual, so each week we'll try and cover many topics that you guys encounter and worry about each and every day while you're raising your little humans.
Good morning. Hi. Today we have Zahra with us. Thank you for joining us, Zahra.
Thank you.
And today we're here to talk about breastfeeding versus formula feeding, which is a very ongoing debate.
That's true. Thank you very much. That's a very good question. So first of all, I have to just say that with no doubt, breastfeeding is the optimal way of feeding a newborn because of the benefits that it provides for the mother and for the baby. However, there are some conditions that formula feeding might be required. It could be because of medical indication, it could be the mother's choice, it could be temporary, it could be permanent, depends on the condition. So I will discuss both of them. So what would be the reasons that it's discussed that breastfeeding is,
It's a time that's very fraught with anxiety for new mums, isn't it? Because, you know, you're having a baby for the very first time, or it might be your second or your third baby, and perhaps the first child that you had, you could breastfeed, but the second baby, you're having a bit of trouble. So it's a time that's really very anxious, isn't it, Mel?
It is, certainly is. And as we know, every pregnancy and every birth and every child is different. So they might have very different experiences. So.
Absolutely, absolutely. So that is why it's very much recommended that we see the mother in advance. We see the mother in advance, check everything to make sure that how we can help the mother and customize that how we can help this baby and how it's going to be the feeding decision for the mother. So then they can make an informed decision about how they want to feed the baby and what is their feeding goals.
Yeah. And I think you started to touch on a few things that could impact on mum being able to breastfeed. Can you go in a little bit more depth about that?
So absolutely. So there are some medical indications that a mother might not be basically able to feed the baby. Like say, just an example is that if mother is going through chemotherapy, so this is a contraindication with the breastfeeding. If baby had, for example, some inherited diseases like galactosemia, baby needs a special formula, but they are very rare conditions.
Yes.
So we have to make sure.
Not the average mum.
Exactly. Yeah. The average moms is that you have to, it's just the common challenges. It could be sociocultural, it could be, the pressure of the community, it could be the mother hasn't been educated, doesn't know about it, and the breastfeeding overall needs practical skills. So without those practical skills, without delivering the evidence-based information to the mother, you cannot expect the mother to do everything on their own.
Yeah.
This is a shared responsibility. Mother needs the full support from family, from community, from health workers. Everyone has a share in this.
And I think you made a really good point before, Zahra, as well, about mums getting education on breastfeeding prior to having the baby, so that they're in a good place before they even give birth. They know about breastfeeding, they know about the challenges of breastfeeding. What kind of things do you offer at King's prior to the baby being born for the mums?
So we have a very nice antenatal classes. It's a group classes. We invite fathers and mothers both, because we always, it's very important to get them involved because they are the support system for the mother, and mother will never be left alone. When the father knows about all these things, he's always at the picture. He's
and
always
they can understand.
And they can understand it.
Yeah.
They can take roles. Which part I can help, which part I need to support you, that you have to do that.
Yes.
So all those things comes to a conclusion that is how important that is to have antenatal education overall and specifically for breastfeeding, and get the family involved in that.
And supporting.
Exactly.
Because even like you said before, that pressure, that can actually impact on the breast milk as well. So having everyone involved, supportive, helps mum. It's all about mum.
Absolutely. Because if we don't support the mother, we don't deliver evidence-based information for the mother, no practical skills or it has been introduced to the mother and helped, then mother might have challenges.
Might struggle. Yeah.
Exactly. So then they will have. But the problem is that, the thing is that now feeling the guilt of it, the shame of it, and the fear of judgment, that will lead to an anxiety for the mother and prevent from seeking help. This is when often majority of the challenges are easy to fix.
And I think too, if you've attended those antenatal classes and if you've listened to the evidence-based research, the actual facts of the matter, and you have an understanding of how breast milk can actually help your child in those first 6 months of their life more, more significantly, then a mother would always choose, I think, to breastfeed her child if she's got the choice. You don't always have the choice, but if you've got the choice, I think you understand that the benefits far outweigh everything else.
Yeah, one of the biggest topics have to be communicated with the parents is the benefits of the breastfeeding, not just for the mother and the baby, for the community and for everybody.
But what specifically are the benefits to a newborn to have the breast milk as opposed to formula?
Very good question. There are lots of benefits for the baby. Number one is that the ideal food for the baby is mother's milk is a perfect balance of whatever baby needs for the first 6 months of life. And on top of that, the mother's milk boosts up the immune system in the baby, so make them strong against infections, specifically ear infection, lung infection, gastro infections for the baby, so significantly low in the breastfeeding babies. At the same time, the episode of asthma, allergy, these are much less with the breastfeeding. It's easier to digest for the baby. And the intimacy provided by the breastfeeding actually is there are lots of evidence that bonding that helps with the brain development of the baby.
Amazing.
And it for the parents, do you want me to talk about the benefits for the mother as
That's
well?
what I was going to say. I know that in my research I saw that there's obviously benefits for mum as well. So can you let us know about that?
There's absolutely benefits for the mother. And number one is that I would always emphasize that the research shows that breast and ovarian cancer is significantly less.
Wow,
with
that's amazing.
Breastfeeding mothers, and the hormones in the breastfeeding in the mother's body, basically, one of them is called oxytocin, and it helps the uterus to contract and go back to pre-pregnancy size. And the breastfeeding is the recovery of all the changes mother had in pregnancy, and it's actually very nice to get back to pre-pregnancy shape.
We want to
get
back into our shape.
Exactly, we all want to get back into our genes.
Exactly.
But, I mean, I've had 2 children. I didn't know that breastfeeding actually helps with that, and also that it can help to prevent cancer. I had no idea.
Yeah,
that's amazing.
These are the things that when you basically discuss, then you might actually help them better to have an informed decision.
Exactly.
Because when they don't know, they are not making an informed decision.
No,
it's just a
might help them
decision
persevere a little bit when it gets a bit tough. Absolutely.
Exactly.
And when I was reading up about you and about King's, I stumbled upon the statement responsive feeding quite a lot. Can you explain what that is, responsive feeding?
That is my favorite topic, I would say.
Great.
Because responsive feeding means that parents look at their babies, follow the feeding cues of the baby, and respond to that and feed the baby. It looks like you're talking about feeding, but it's a little bit deeper than that. So you're grabbing the attention of the parents from the clock to the baby's face. There's nothing written on the clock. Everything is written on your baby's face. So what happens? I, as a parent, I'm just looking at my baby. And I make sure that I understand every single bit of move of my baby. So it's not just about the feeding cues. It is about cues of the baby, feeding cues at the beginning. But then it becomes a habit. So you respond to the baby. So the idea, the deeper meaning of responsive feeding is to build a strong relationship between the parents and the baby. So what happens? Parents actually responding to the baby starts with feeding cues, fulfilling, satisfying the baby's feeding needs, but then later it's a habit. You just keep responding to the baby. You hold baby more often, you pay attention more often to the baby. But at the same time, on the other hand, the baby learns, there are 2 people around me.
I need to give
even
cues.
more than that. With this smell with this
right.
touch,
Just
with
the
this
bonding
voice,
again.
that they are there for me.
Yes.
Now they start building a relationship on trust. And that is very important.
So it's so much bigger than just
it's
feeding,
much
isn't
bigger.
it?
And it does apply to breastfeeding and bottle feeding, formula feeding
Yes.
babies. So that means responsive feeding is not just about the feeding. It's about responding to the baby, building a relationship with baby on trust.
Wow, that's really amazing. So you're not just doing okay, I'm going to feed it, 2, 4, 6, 8 kind of thing. You're taking the cues, you're establishing that bond with the child and, understanding their nuances in their behaviour.
Absolutely.
Their personal routine rather than our routine. They're getting into
absolutely.
us.
Enforcing a routine on the baby.
Enforcing a routine, that's well said.
Absolutely.
So when we talk about breastfeeding, can you discuss some of the challenges that mums face with breastfeeding?
Absolutely. The first few days, it feels sometimes that it's a full-time job, day and night. And it makes mother tired, and sometimes the father even feel that I'm left out. So these are the things that sometimes happens. But again, when you prepare them, that
set the expectations.
Exactly, set the expectations. That this is because of the small stomach size of your baby, because your milk needs to be built up. You need to work like a team.
Yes.
Give it a week. Give it a couple of weeks, and then you see things will be different.
Yeah.
So having that discussion and the mindset that they have in advance before they come after baby in their arms, then it makes a huge difference. And the father understand that, okay, there are some parts that I can take the role, and always mother can pump some milk, express some milk, and father can feed the baby.
Yes.
So they will understand after some time that, okay, how can I help better? Where are the gaps that I can fill?
Yeah.
I am involved, definitely.
Yes.
I'm not left out, but how can I help?
And mum just kind of needs to, I guess the first few days, it's a very intense time. You get, the blues a little, some women experience that a lot, some just a little. And then, you're also just trying to get used to breastfeeding and learn how to do it. Some women take to it so naturally, and other people like me just totally did not take to it. And it was really a challenge for me to learn how to breastfeed. And then I got mastitis and, several other things which can be really painful and really put you off breastfeeding as well.
Yeah. So I was going into that other challenges, like the one that you just mentioned. Usually what happens when the mature milk starts to kick in and come, mother feels heaviness on the breast. This is what we call it engorgement.
Yes.
And this is one of the things that we call it a challenge for the mother, but it can be prevented. It can be, again, the mindset of the mother within these days. You're going to have a little bit harder breast. You're going to have a production starts to kick in. Yeah. So I want you to be aware of your body. It's a simple language with the mother. Yeah. Get their hands on the breast. So this is what it feels like getting hard. This is what it feels like. Oh, it's okay. So within those days, they'll make sure that you're more aware of your body, check your breast regularly, and don't let it get super heavy. Because when it gets super heavy, it becomes painful, it can cause potential infections, so it can be prevented. So the best way of helping the mother first is to teach them how to prevent things rather than when it comes the problem. Of course, you discuss how you basically overcome the challenges, how to manage them, but however to preventing them is the most important part.
I was just going to say, I feel really sure, and in my own experiences too, those first few days in hospital, if you've got a really supportive team of nurses and midwives around you that are helping you with those things, showing you, the indicating signs. Okay, now can you feel the difference in your breast now? And just getting, even mentally, getting you through those first few days when you're experiencing all these things.
Absolutely. As you mentioned, the first few days are crucial days. Yeah. And we have to understand that mother also recovering from the birth as well.
Yes.
It's not about just the baby. You have two people to take care. But let them work as a team. Put them together. Remove all the barriers between mother and the baby. Keep them in the same room. Help them to understand how to responsive feeding, how to feed the baby. One of the main challenges is the soreness on the nipple, which is usually about the way the wrong positioning and attachment techniques, which can be easily taught to the mother. So it's very important those first few days that fully support the mother and the baby, has a lot of hands-on practical skills for the mother, and make sure she gets confident.
I think they give you lots of ways to cover, if you're feeding, this might not feel comfortable for you, and even when you have twins or multiple births, all different suggestions on what you can find so that you're comfortable with the experience.
You're absolutely right.
And like Lee said, those people that are there in those first early days to say, look, that doesn't kind of feel right. You don't really know what right is. And say, okay,
exactly.
put a pillow underneath you, or you might want to hold them this way and that.
Absolutely.
So it's, you can go home feeling a lot more confident. And,
what you're saying is absolutely right. I mean, when I ask a mother that, she says, I'm breastfeeding, is sore, but it's okay. And I say, it's not okay. It's not. How come being sore is okay? That means that we can do a little bit better work. So let's see how I can help. Let me watch. Let me see.
Let me watch and see what we can. And sometimes it's the smallest change, isn't it? Like you're just talking about the position of the baby or the head, the smallest change, but it can make such a difference, can't it? Yeah,
absolutely true.
Yeah,
absolutely.
So we've talked about the challenges of breastfeeding. What about the challenges of formula feeding?
Very good question. So the challenges for formula feeding, basically, number one is the convenience and availability.
Absolutely.
We all understood that in the pandemic time, that it was not always available, but mother's milk was available with the baby at all times. And the cost involved to that, and the preparation is timely, but it's very important for us to understand that once formula feeding is in the picture, again, that is our duty to make sure mother knows exactly what type of formula is the best formula that suits her own baby's needs, because it's different, might be different with each baby, right?
There's so many different formulas.
Exactly. So there are different formulas, not that they are completely different, it's just marketing sometimes, but however, so mother knowing scientifically that which one is the best one for her own baby, suits their own baby's needs, at the same time how to prepare it, that formula.
And the sterilization process.
Say how to safely provide it by WHO guideline. At the same time, how to store it, how to give it to the baby, how to the paste bottle feeding. All those things is skills that nobody knows. So don't assume that, okay, go and buy this, and then no. It's a full session. So as we're discussing and teaching mother how to breastfeed, remember, nobody should be making decision for the mother. Our job is to make sure that they know about all these facts, advantages, disadvantages, but decision, how they want to feed the baby, is from the mother. So we have to make sure that they make an informed decision. But once they make the decision, it's everybody's job to make sure that they support the mother, to make sure that she actually meet the goals of her infant feeding, what she wants to do. So
I remember feeling very jealous of breastfeeding mothers when it was 2 a.m. in the morning and you have to get up, wander down to the kitchen and do a full prep of a formula bottle instead of just grabbing Bubby from the cot and, attaching them in bed, laying down. And I used to feel very jealous that I had to fully wake up and, go through that entire process. So I know that I wished I was breastfeeding many times instead of, and the sterilisation, it's intensive, isn't it? That whole bottle washing process.
And when you're basically formula feeding is very time consuming.
Very, yes.
And breastfeeding, as you mentioned, you just wash your hand to feed the baby.
Yeah. And you don't go on holidays when you're formula feeding. You don't go on holidays because you've got to take the steriliser and then you've got to make sure you've got a microwave.
You don't need any equipment, you don't need anything actually. It's ready at the right temperature, just wash my hand and feed the baby. But one more thing is important, that we know that there are no formulas. This is acceptable food in the absence of mother's milk, but there are no formulas that provide any immunity.
They don't help to build the baby's immunity.
That's another thing that we have to consider.
Right.
But I would always say that the first priority is to feed the baby. Every baby is different, as you mentioned. Every mother is different. So you have to make sure that at the time, at the condition of them both, considering both how you can help them, of course, with the priority of the mother's milk and the mother's decision how she wants to feed the baby. However, if formula is in the picture, again, we have to make sure that mother has full education and to minimize the risk of infection, because usage of formula can be associated with higher episode of sickness for the baby.
And whether a mother is breastfeeding or formula feeding, when it's time for her to return to work, what are the things that mums kind of need to be aware of in that preparation for going back into the workspace?
Yes, very good again. Preparing mother in advance is the key for that. So if mother is breastfeeding and wants to go back to work, we usually ask the mother to have some stored milk in advance. That always will become easier later when she goes back to work, and she can start pumping and from day one that baby is born. But the extra milk to store, we usually suggest after from third week and after.
I remember you used to have a lot of bags of breast milk.
I did. I'm a preparer, so yes, I used to have. I was worried that something was going to happen.
Very nice.
I did.
And you know,
there's nothing else in the freezer, just
breast milk.
I had to buy a chest freezer at one point. Put the food in.
I had mothers; they had to buy another freezer, actually an extra one. So you probably were one of them. So yes, that it always brings.
So after 3 weeks, they can start.
They can start pumping from day one, but we suggest the first 2 weeks, whatever your extra pumping, give to baby, because they are losing weight, gaining weight. They are at the beginning. They are at the higher risk of maybe growing jaundice. We want the baby to feed more,
and dad can enjoy feeding the baby too with a bottle. Then
quality time feeding the baby. So it's another thing: relieve mother and rest. But from third week, if baby getting what baby needs from the breast, that extra milk that mother is pumping, instead of let's say the last week she wants to go back to work and now she has to rush. Then she can spread the work.
True.
Twice a day. You can pump, keep it in the fridge. You didn't use it at the end of the day, put it in the freezer. It can be stored in the freezer 6 months.
6 months. I was just going to ask you how long.
So that's a good question.
6 months you can store it in the freezer. Now, right before going back to work, a week before going back to work, I usually discuss with them, it's very wise for the mothers to have a discussion with the workplace. Discuss about, is there a possibility that I can work from home? Is that an option? If not, then discuss about the breastfeeding time, which legally every mother is entitled to. Or pumping time, check the private area, make sure everybody's mindset at work knows that this is what you're going to be doing when you're going back to work. Now, when mother goes to work, it's like a pumping at work, breastfeeding at home plan to make sure that she maintain her milk supply, at the same time baby benefit from the milk that mother is pumping. The milk she pumps at work, she keep it in a cool box with an ice pack, transfer it definitely in Dubai, everything should be transferred to the cool box and an ice pack, and then goes to the fridge. When baby will use it, the day after. Right. Now, today I was at work, I was super busy. I was supposed to pump 3 times, I pumped 2 times only. Then where is the backup? In the freezer.
Yes.
Yeah. So you see that backup, how it can fill the gaps. So it's not routinely you're going to use it. You still will breastfeed and pump after going back to work, but you have a nice backup in the freezer.
Yeah. Excellent.
And then how long do you think that people should just breastfeed for, and when should solids be introduced, ideally?
Very good question. What is the WHO UNICEF recommendation is that the first 6 months, if mother's breastfeeding, all baby needs is the mother's milk for the first 6 months. But at 6 months is not enough. And to be adding the solid food for the baby at 6 months and continue breastfeeding as long as mother and baby wants. But the recommendation is up to 2 years or beyond, because the research has been done on those timing. However, the decision is mother's. I have people going over that. I have people less than that. But at 6 months is the time that they are suggesting, even formula-fed baby. baby. The first 6 months, they are using the formula age appropriate for the baby, and at 6 months you add solid food. The pediatrician who's checking the baby, either breastfeeding or formula feeding, they will suggest otherwise if it's needed.
Okay. So it's, most babies, the average is 6 months, but on a case-by-case basis, as we know, every baby's different.
Absolutely. Let's say premature babies a little bit earlier, like babies born before, let's say, 35 weeks.
To try to put their weight on.
Yeah, exactly.
And so I've heard many times that when we had our children, that you should not bottle feed post 12 months because it can have damage their teeth. Is that correct?
So there are many research done on the bottle with teeth usage, and first of all, it's not recommended the first month. Because nice cups are provided in many hospitals that baby can either mother's pump milk or formula baby can get it through a cup. And that is because the way baby suck on the bottle with teeth is totally different from the way that baby suck at the breast.
Yes.
So that can actually interfere with the mother being sore or affect her milk supply. So because of that, it's not the first month until milk supply is established, it's not recommended. After that, with very good hygiene, because it can be usage of pacifier, and teeth can be the number one source of the, as you mentioned, the oral formation of the baby.
Yes.
At the same time, the thrush and infection, this kind of infection for the baby in the mouth. That's why the sterilizing is very important. Many mothers choose to do cups, sippy cups. And once you start, we have many mothers that once they start from the first month, and they continue doing that. Unless mother wants to go back to work, or they have a provider for the baby, they're not sure if they can do it. So in those cases, they go to the bottle. But usually, you are right, there are evidences that it's talking about that, and we want to avoid as much as possible. But then again, if it's needed, then with good hygiene, it can be used.
Okay. Well, thank you, Zahra. We've really enjoyed talking to you about this. It's such an important topic for mums. And I think, out of our conversation today, my biggest takeaway is that we really need to ensure that mums are doing their antenatal classes, so they have that really good understanding. They're setting the expectations ahead of the birth, and then they have that support network that's around them, community, family, their hospital, their midwife, their nurse team, and their paediatricians, so that in a post-baby environment, they have everything they need to thrive.
Absolutely.
Thanks for joining us.
Yeah. Thank you.
Thank you so much.
Thank you very much.
And here come the legals. Our podcast is purely brought to you for educational and entertainment purposes. We are just two hectic mums, and we are certainly not licensed therapists.
This podcast is not intended as a substitute for the advice of licensed or qualified professionals. And if you do need some help, please seek out some professional advice.